Hi, I'm Susan Gallagher. I'm a First Contact Dietitian working in Chester. I work in GP practices within a primary care network, so I cover 5 GP practices, providing dietetic input and expertise. I see patients at different stages, so some patients at that stage where they're presenting with symptoms and we're exploring possible diagnosis. We also see patients referred from other clinicians. We see a range of conditions, mainly diabetes, frailty, weight management and gastro-type conditions. The main difference between a dietitian and a first contact dietitian is that we are involved in the earlier presentation, so with undifferentiated and undiagnosed conditions. We can be involved in assessments and investigations in order to help support a diagnosis. And we can be involved earlier in a patient's journey, often in that presentation within primary care. Sometimes seeing patients from the front door, so from reception, or sometimes via referral from our colleagues.
Would you mind popping off your shoes so that we can get your weight a bit more accurately?
A first contact dietitian has years of experience and a high level of clinical practice as a dietitian. We also bring experience from a research, leadership and education point of view to strengthen how we work within the primary care team.
So I'm just making a note of some of the symptoms that you're describing. Would it be okay if I got a sample from you today? Yes. So I'll pass you one of our sample pots, and if you just go out into the corridor, there's just toilets on your left hand side, and then when you're ready just come back in and take a seat again.
The opportunity to become a first contact dietitian was really exciting. It gave more opportunity in terms of career progression. It also meant getting to be involved with our patient care much earlier in their diagnosis than we traditionally had been with community and specialist services. So it seemed like an exciting opportunity to use my skills to a better degree and challenge me further in my career. The different approaches to becoming a first contact dietitian can be through a taught route via university study, or can be through a portfolio route. The portfolio route involves capturing a range of evidence to demonstrate that you can meet the competencies of a first contact dietitian.
How often overnight do you feel like you're having to wake up?
I think it's important to try and take on a range of clinical experience to build up your repertoire of skills as a dietitian. You will see a range of patients in the primary care setting, so having that background is really, really helpful. I'd also suggest linking in with colleagues who have experience of working in primary care to understand the day-to-day role and how you work within the team that's in primary care.